Hello, everyone, and welcome to this orientation session for the MRCPCH Clinical Exam. My name is Dr. Isra Hassan, okay, and I'm really happy to see you all here today. The purpose for this session is to guide you through what is the MRCPCH Clinical it's all about and why it's considered difficult, what the exam structure looks like, how to prepare effectively, and finally how to apply for the exam. I know many of you are worried or confused about where to start. That's completely normal. Okay, that's really, really normal. Today, I want to make things clearer for you and show you that passing the exam is very possible. Yes, it's really very possible if you approach in the right way. Okay, you have to approach it in a right way. How to approach it in the right way? How to practice? How to study? This is the whole point about the difficulty of the exam. All right. So why the MRCPCH clinical is difficult? Why you considered MRCPCH a difficult exam? Let's start with the big question. Why do so many candidates find the exam difficult? There are several reasons for that. Because it's not all about knowledge. Okay, it's not about knowledge only, I mean. You have already passed the written exam by now, so you clearly know pediatrics. I completely trust that you know pediatrics well. But this exam does not only test knowledge; it tests how to use this knowledge in the real life. How to use it? Yes, that's really the proper word. And how to show confidence, all right, in front of patients and in front of examiners. This is the biggest point in the exam. All right. Also, we have another pressure that may face you. That is the time pressure. All right. The time pressure is really intense, and each station is only 9 to 12 minutes. That's very short time to take history, perform examination, how to communicate with the parents, how to you need to be sharp, you need to be structured, you need to be focused. This is the whole point about the time, and you have to tell the right words in the right time. All right. And this is not easy. It's not like the theory exam that you have time. I can think, I can postpone this question to the end of the exam. I will revise it again. No, you have to be sharp. You have to say the proper words in the proper time, as I just told you. This is the time pressure. Also, you have to combine many different skills. You need to show good history taking, for example, in the history station and the development station. You have to do the clinical examination perfectly and properly. In the development station, you have to do history and the assessment, all right, and to be and also to like assess the ethics and do with the ethics in your interpretation and in your approach. That's all in one exam. Okay, so you cannot rely on the one's strength in knowledge only. Okay, and also the stress factor. The stress factor here, that you are being observed directly by the examiners, and sometimes with the parents, sometimes with the role players. Who are role players are the actors that they do just a role to make themselves appearance in front of you, or for example to make themselves patients. Even confident doctor can suddenly feel anxious in such situation. So it's really stressful, and it's really normal. Okay, but staying calm under the pressure, okay, is one of the hardest part of the exam. All right. So overall, it's not just a test of knowledge; it's a test of ability to act as safe doctor and competent and professional pediatrician in front of others. All right. This is the point in it. And I have been asked lots of questions like, how can I book the exam? I didn't start working. Can I still pass the exam? Is the exam is hard? As I told you, the hard part of it is because it's the nature of the exam, the stressful condition of the exam, not the exam itself. All right. I don't have a center in my country, so which center can I apply to? Right. How to book the exam is super easy. First thing to get to know that the basics for example, for the exam that you are already, I know that you already have an account on the MRCP or the RCPCH website. All right. And just as opening the link and passing your theory exam will make you just you find the option that you can book for the clinical exam. All right, it's so much easy. I will leave the link. You will find it's very useful. You will find lots and lots of questions regarding the application process, how to do this. Okay, and applying through the RCPCH official website. And the clinical exam is offering several times per year in the UK and overseas centers. All right, and then you'll be filling spaces. Okay, it's very clear, and then you will book for the exam as much the application open as soon as the application open. Then you'll make sure that the your MRCPCH account, candidate number, documents, payments, everything is okay. Then they will give you a deadline. After before this deadline you have to pay. All right. But if you miss the deadline for payment, you have to wait until the next start. All right. After that, that's all about it. I will leave this link below in the description of the video. All right. So you will find everything you need regarding the application of the exam. Okay, I didn't start studying. Will I be able to pass the exam? Yes, you can. Yes, you can. Totally, you can. If I just graduated, I'm not working in pediatrics for a long time. Just that you are a doctor. You can pass the exam. All right. It's hard work. It's hard work regarding knowledge, regarding practicing, regarding focusing on important things, regarding working with a team. All right. It's not easy, as I just told you, but you can. Yes, you can hit the exam if you are not studying for a long time. If you are working, you're not working in pediatrics, it's easy to pass your exam if you work on it. So we have in the exam 10 stations totally, all right, and five different stations. We have clinical, communication, history, video, and development. Let's take it one by one. The clinical examination, you'll be asked to examine one system, for example, as sometimes do general examination. General examination means that you will be doing all the systems of the body. For the other station, for example, you'll find that you have a syndrome and you have to be targeted in your general examination. All right. So and other station like cardio and your station, the examiner will be telling you that this is your neurological station. Please examine, and he was going to tell you the personal data of the player or the patient, and then you are going to examine him. All right. All you have to know about the examination is the classic examination to be fluent in your examination. Okay, cardiovascular, respiratory, abdomen, neurological, musculoskeletal, other stations. We have different clinical stations. You have to perform the approach smoothly while you are doing it in the exam. All right. The examiner after that will interrupt you maybe and asking you questions after you finish your approach. All right. This is the clinical exam. We have 4 clinical stations in our exam. Each of them is 8 marks. Okay. If you are not practicing pediatrics, all right, the clinical part will be a little bit challenging. You have to at least know the normal thing. Okay, so we have to practice on some patients before the exams. Some people are really taking live mocks in the country, in their countries. In Jeddah, for example, they are doing in Egypt and in the UK. You will find lots of live mocks. Okay, you can find patient, interpret the signs you can see. Okay, you can examine. So it's not that much hard if you are not doing examining patients and putting your hand on patients. You are not in the field. So You can take mock exams, you can visit your friends in a hospital, for example, but you have to be involved in that, in performing the approaches and involved in seeing patients. You have to see the signs in front of you at least at the mock exams. All right, once at the mock exam, I mean. So this is the clinical part of the exam. We have communication part. All right. You'll be asked to explain something to the parent, break bad news to the parents, handle a difficult situation with a colleague, for example. You have to be empathic. Okay. The key here in the communication skills is to be empathic, to be the key is empathy, clarity, and professionalism in showing the patient that you are responsible and you are hearing him and you are caring for him, right? And as a part of the team, to be like confident, to be like clear in telling the data or the information to the patient. And also, if the patient is angry, anxious, I mean the parent or the patient angry and anxious, you have to handle the situation, right? That is all about the communication. You have to come. We have to come in the exam. Each of them are 8 marks. Right. And we have the history station. All right. The history station is you are meeting a role player, and you'll be asked to take a focused history. Okay, the history must be structured and covering all the key points in the scenario. I mean, for example, if I'm taking history for asthma, I have to cover the triggers. I have to cover the toxicity of the corticosteroids. I have to cover the asthma. Severity. I have to know if it is mild asthma, moderate asthma, severe asthma. I have to take in my consideration the differential diagnosis of the asthma. Maybe it's not asthma, it is, for example, a patient with a chronic lung disease, or he's having a cystic fibrosis, bronchopulmonary dysplasia. I have to cover all the other points, right? So I have to put my hand on what is the cause and what is the differential diagnosis from taking the history. After that, I will be discussing with the examiner about the history I have taken, the management plan, about the my case, right? Um, and summarizing everything clearly to the examiner also is very important and super important in this. Okay. Then we have video stations. Okay, the video station, you'll be seeing a video, and this video it will be for 3 minutes. After those 3 minutes, we have a discussion for 6 minutes about the management plan also. The discussion for the video station is 6 minutes. It's considered long, but the longest discussion for the management plan will be in the history station, which we have 9 minutes with discussion. You have to discuss anything. Okay, the examiner is going to tell you and ask you in the history station. And then we have the developmental station, and you'll be assessing the child development using toys, for example, for using or observation of the child when he just entered when once you entered the room, what he was doing, and then you will check the milestones of the patient, gross motor, fine motor, speech and language, social, everything regarding the examination of the child and engaging the child in a friendly way, how he is going to play with you, how you are going to involve him. All right. And also we have here in the development station, we have also a history. Okay, taking the history taking is super easy, and it is like taking history from any other station, from the history station. I mean, it's really easy, and you're going to gather also an important information regarding the development itself. It's easy, but you have to be focused on also the problem you have, and you have to be focused on the task you have. Okay. Uh, all right. How to study? How to study all of this? They looks really really complicated, isn't it? let's talk about the most important part is about how to study. The exam is very different from written paper and cannot just read books and expect to pass the exam. All right, this is really the main point here, and you need to practice in performing those. Okay, you have to understand the format clearly of the exam, as I just told you. You have to practice the history and practicing the examination, right? You have to practice how to finish them in for example 8 minutes, in 9 minutes, in 6 minutes. All right. Also, you have to learn the for example, for the history, you have to be have you know the fixed sequences of each system. For example, in the cardiovascular system, you have to do this and this and this. I mean, everything like this. All right. And for the communication, and you have to and the communication reading is really useless without practicing with a colleague or even a friend. So you have to learn how to use the empathic phrases. I understand your feelings. I'm really, really sorry to deliver you the bad news. I want to explain this clearly for you. I'm all ears to hear you. You have to know how and when to use those phrases and to understand your patient, all right, according to the situation, all right? Uh, and also you have to have a practice on the structured discussion with your colleagues or your study group. We have to revise the guidelines and like surgeries management, asthma, diabetes, safeguarding, and an accidental injury, for example. You have to practicing the management plan clearly, how to assess, investigate, immediate management. I mean, the long-term management, the team is super important here. Okay, and studying in a group is really the best strategy here. All right. In groups, one person can be the examiner, and one can act as a parent. Okay, and one can practice. This gives real feedback and simulate the exam atmosphere. And really, really study groups, small groups are a plus. You have to care for the study group. You should be uh, uh, you should be working and having one. Okay, so this is the biggest secret in passing the exam in really the in really short period of time, and in really you're going to practice every single thing in the exam with the study group. Study group is really a plus. Pivoted about that. Okay, about the sorry, which center should I apply to? Uh, some countries do not have such centers to apply to, like Sudan, like Lebanon. Okay, and some countries do not have a center in it. But UK, Malaysia, and Qatar, Singapore are really now open to those people who do not have center in their country. And the UK is really cheaper, the cheapest one, yes, and they are doing lots of exam. The point in UK that their clinical cases are really, really different and various, and they are you can find anything in your clinical exam. Okay, Malaysia is really easy at those at those they became easy exams. Also Qatar, Singapore are very good and positive feedbacks about them in the last few exams for them. Okay, if you have any questions, all right, I'm here for you. Just send me if you have anything that I can help you, I'll be helping you. Okay. I'll be putting all my details, and if you'd like to just contact me for anything, you're more than welcome. You'll find me replying to you, answering all your concerns. All right. It's very nice meeting all of you today. Thank you so much for your attendance, and have a very nice day. Thank you so much.